Well, welcome everybody. Thank you so much for joining us for our webinar today on inspections in a healthcare world. Today we have three panelists from University of California, Davis Health, EH&S, and Pharmacy Services, sharing how they have leveraged technology to grow successful EOC rounding and medication security programs. My name is Maura Heilman, and I am the Healthcare Program Manager here at Risk and Safety Solutions. I will be your host today, and I'll be asking questions of our lovely panelists. But before we get started, just a couple of housekeeping items. So basically, any question is a good question, so please don't hesitate to ask questions at the end. We'll carve out about 15 minutes for questions, and you can use the Q&A in Zoom to type in your questions, and we'll do the best we can to get to them. Besides that, I think we're just ready to get started. So why are we talking about this today? In the past couple of years, especially in the healthcare industry, they've been struggling with rising costs and workforce shortages, yet healthcare professionals are being tasked to do more with less. Folks are increasingly starting to use technology to manage healthcare safety for efficiency, streamlining processes, having access to reports and metrics. More institutions are moving away from the paper process and moving towards automated ones. And I just think it's a really good time to share some successes that our partners at UC Davis Health have had recently, and in addition to some challenges, and continue to work together to find ways to leverage technology moving forward. So we hope that by joining today, you'll have one or two takeaways to help grow your survey program and be able to meet compliance. So without further ado, let's get started with some introductions. Erica, would you like to start us off?
Yeah, thanks, Maura. My name is Erica Olakis. I'm the Supervisor of Environmental Programs within Environmental Health and Safety, EH&S, here at UC Davis Health. Over 15 years of experience in environmental compliance and have been in my current role at UC Davis Health for just over 5 years. And I'll pass it to Tom.
Thank you, Erica. Good morning, everybody. I'm Tom Ochiltree. I have over 25 years of healthcare experience, from environmental services to waste compliance and minimization management with health and safety. I've been in my current EH&S specialist role with UC Davis Health for about 5 years. I currently oversee our operational waste programs and our lead EH&S specialist when conducting our weekly environmental care rounds. And San.
Thank you, Tom. I am San Hua, Senior Medication Security Pharmacist. I have more than 15 years of experience being a pharmacist for UC Davis Health. Throughout my career, I have an interest and passion for regulatory compliance. So I spent the last 6 years on the Medication Security Pharmacy team, serving all the medication storage areas within UC Davis Health. So it's my pleasure to be here today and join this webinar.
Great. Thank you guys all so much. A lot of years of combined experience. I love that. So I guess, Tom, let's get started. Could you give us a little update on UC Davis Health? They've had a lot of recognition recently and are ranked as one of the world's top hospitals. Can we learn a little bit more about the organization?
Yes, of course. In its entirety, University of California Health includes 6 academic health centers throughout California. There's 20 health professional schools, 4 children's hospital campuses, and we are a global health institute. Here at UC Davis Health, we cover the greater Sacramento area region in Northern California, servicing 33 counties, covering 65,000 square mile area that runs north to the Oregon border and east to Nevada, employing over 11,500 staff members. Our UC Davis Medical Center is a 646-bed, multi-specialty academic medical center located in Sacramento. We currently are building for the future at our medical center, and we've begun a number of construction projects on site. 2 of the larger noted projects are a new tower that's targeted to open in 2030. It's a 1 million square foot, 14-story structure with single rooms and more critical care adaptability. The tower project will roughly double the square footage of the medical center, creating a total between 675 to 700 inpatient beds for the entire complex. And then we're also building a new same-day surgery center on campus, and that complex is about 267,000 square foot, includes 14 operating rooms, 59 pre and post operative recovery bays, and 14 single occupant overnight recovery rooms. In addition to these on-site expansions, we've got several off-site clinical expansions throughout the region.
Wow, sounds like you're going to be busy. Doubling in size is a lot. The amount of inspections is going to go crazy. Can you talk a little bit about the programs you guys have implemented? San, maybe you could start us off there.
Yeah, happy to do so. So we used to use Veriform, which is a checklist management system. We used to print out the checklist, we handwrite our notes, we complete the survey, and then we go back to our desk, or we try to find an available computer to document our findings, and then we submit it electronically. So we implemented RSS Inspect at the end of 2018. And now each team member has an iPad. We use our iPad for every single inspection. We use the RSS Inspect app to document as we survey. We take pictures within the application. We then electronically submit at the end of the survey. There are a couple of tools that I'll share a little bit later in terms of discussion tools and other tools that we utilize within the application as well. And analytics is also another one. Our team is comprised of 2 pharmacists, 3 pharmacy technicians, and 1 per team pharmacist. So we have quite a small team, but we actually survey on average over 180 areas per month. This includes inpatient units, includes outpatient ambulatory clinics, includes perioperative areas. So really any area where medications are stored, we survey at least on a monthly basis, if not quarterly, depending on the type of licensure. So I'll pass on to Erica to share more.
Yeah, thanks, Dan. So for the environment of care rounds that we conduct here at UC Davis Health, the Inspect tool was actually already implemented and in place when Tom and I arrived 5 years ago. But from what our leadership has shared with us, the original environmental rounds team actually consisted of a fairly large multidisciplinary team who utilized paper checklists and would track all findings via email. So each team member would be responsible for certain numbers of findings and would be responsible to track to completion. So in 2015, UC Davis H collaborated with Risk and Safety Solutions to create an electronic inspection checklist within Inspect. Our current director was actually a part of the original team in 2015 who worked with RSS with developing this checklist. The checklist was then not only developed for the UC Davis Health Medical Center, but was also used and developed for all of the UC medical centers across California. And so in the end of 2016, UC Davis Health began utilizing the Inspect tool for our weekly environment of care rounds. We continue to utilize the same checklist within the Inspect application for our weekly rounds. And in addition, we also use the analytics application, which helps us to review data and helps us to evaluate our effectiveness of our program. Our current team is a little bit smaller than the original team, but we currently consist of environmental health and safety, licensure and accreditation, infection prevention, plant operations and maintenance, and our fire safety team.
Thank you, Erica. Sounds like you guys have come a long way since you've been using those paper checklists. Glad to hear it. San, I know that rolling out an electronic solution can be very overwhelming. Can you talk a little bit about how your team did that and how you were successful with the rollout?
Yes, of course. So we were more of the later adopter of this application. So we, like I mentioned, implemented RSS Inspect toward the end of 2018. So, we have had other internal groups utilizing this tool. And what was important for us was we had leadership buy-in. We had a very supportive group of leadership. They really wanted us to utilize the same application that others within our institution is already using. So, pharmacy leadership, they were in full support. They helped us in terms of ensuring that our team had enough time for training. We built all of that within, our schedule to allow for meetings with RSS success specialist, as well as, carving out all of the time necessary for the training. When we rolled out, we shared with our RSS representative the existing survey checklist that we were using with Veriform, as I mentioned earlier, so that this checklist, we did fine tune it a little bit, but that this checklist can then be uploaded into the system so that's ready to use. We utilize a single checklist system just to make it easier for maintenance. And then, of course, depending on the area that we inspect, we may we have different categories. So we will select certain categories as non-applicable if that is the case. We had scheduled multiple meetings, as I mentioned, with our customer success specialist. And we made sure that our small team is very comfortable with utilizing the application before rollout. We practiced a little bit with, the test department for documentation. Overall, RSS was really user friendly, but we still wanted to make sure that everyone is comfortable. We also decided to have an overlapping period with Veriform just in case we need to go back. But we found that once we rolled out, it went really smoothly and we didn't go back to utilizing Veriform. So that overlapping period that we planned for, we really didn't need it. I think some of the components for having a successful implementation include having a checklist, and then also having the training, and also to allow for your team members to practice before implementation so that if they have any additional questions that were not addressed during training, we can address that. Again, I feel like, the application is really user friendly, but having this opportunity to, practice really is important. I think it's very important to be open minded as well because it is quite different than what we were used to. So, the initial period was, getting used to, okay, we don't have to print out any papers. We are just going with our iPad. And then, communication is also key. We, communicated with all our team members. We work very closely with our customer success specialist in this rollout. So I'll pass on to Tom to share a little bit more about how we maintain this program.
Yeah, perfect. Thank you, Stan. And as Erica mentioned earlier, for the environment of care rounds, we had begun a transition back in 2015. And at that time, we sent a survey to our clinical managers to gather some input of just what was some successful models and what was some areas of improvement for our general program. And there were three overall themes that emerged from that survey. The first one being that the clinical managers did prefer a smaller group of rounders to come through their areas. And the managers wanted the rounds to feel more like a survey with more interaction with on-site managers and supervisors and more in-person education. And so they just didn't want someone rounding through, leaving. They wanted to kind of be, part of the rounds. And then last, they wanted access to the reports within 48 hours and better documentation and tracking mechanisms. So taking that into consideration, we have continued to implement these items into our maintenance of our program. We continue to gather input on an ongoing basis, and we adjust our process to align with operational changes over time. For example, during the height of COVID, we weren't able to round in person, but we continue to send our checklist out to departments. And so our departments were able to run through the checklist, and then we were able to electronically still gather the data and submit it through the electronic survey. And that way we have the data still going back during a period of time that we were not able to be out in person, but we were still able to capture that data. And there were still follow-ups. So the department was able to conduct a self-audit, send us in the information, and then our core team of an environment of care team was still able to help them mitigate items that were still open and needed, closing to ensure that we maintain our requirements and as needed for our accreditation surveys. As for the scheduling of our program, and continued improvement of our core EOC team members, we create a tentative schedule that's shared with just our rounders. That team is aware of the annual schedule, but our departments are given a 24-hour notice. And so we do give them a courtesy notice that they're coming. We try to mimic an actual regulatory survey, so there's not significant notice because we want to see how we're functioning day to day in real time. But we also want to give them a heads up so we ensure their collaboration and their involvement as we round their areas. We found over time that the program works when you really engage the department stakeholders because they're vested and they want to make sure the departments are compliant, and then we're the key stakeholders and subject matter experts that can help guide them that direction. So in addition to the rounds and adjusting our scheduling and notification to those users, we hold an annual training for our rounding team, which consists of an appreciation event for our rounding team where we bring in lunch. Leadership hands out certificates of appreciation to each team member for all their hard work. And then we bring in subject matter experts to further educate our core rounding group. And we try to focus on areas that would be areas of target for the following fiscal year or calendar year. And we try to align those with items that may be things that came up in our Joint Commission previous surveys or common items we found during, environment of care rounds.
Great. Thank you both. That was awesome. Let's move on to what efficiencies or benefits have you seen from using an electronic tool? Sam, would you like to start us off?
Yes, sure. So, automated emails are really, really helpful because this really helps the area that we inspect know that, yes, a survey has been completed and ready for their review, and that they can jump on and look at, what findings, were documented and work on resolving those findings. I mean, oftentimes we conclude our survey with reviewing of the findings, but this is the opportunity to actually see it and then review and resolve electronically. We also, as Tom mentioned, we want to engage our staff. We want to share the regulations, share the standards. So we have incorporated Joint Commission standards as applicable to each of the finding. We built that within RSS Inspect app. We have standards of performance, of course. We have our hospital policies. We have the regulatory requirements as applicable. We really try to promote a culture of collaborations and really try to engage all of our key stakeholders. And some of the features that we utilize quite a bit, like I mentioned, is taking pictures because a picture really truly is worth 1,000 words. We also utilize routing groups, which are customized groups to involve our key stakeholders. So we send specific findings. When we route, we send specific findings to these key stakeholders so that we can begin our discussion. And sometimes the discussion is offline. Other times the discussion is within RSS Inspect, where we go back and forth and we involved any key stakeholders. And then, we kind of discuss within that survey report. Some of the rounding teams that we have include environment of care, or environment of care, environmental safety, or environmental services, I should say, distribution, anesthesiology department. We also use tagging. We use it it's limited, but we have a couple of tagging groups. So, for example, for my survey or our survey, medication security survey, we have a pharmacy tag so that we can utilize the tag really for process improvement and reporting purposes through RSS analytics. We provide a significant amount of education when we go and survey as well to the area that we survey. And then, of course, we reinforce our education with the survey documentation and the various standards and policies that, we embedded within RSS findings so that, the staff know exactly what is the requirement, not just, the surveyors asking us to do this, but, where's the requirement coming from. So with that said, we one of the example that I can share in terms of our collaboration is actually with Tom's team, where they had a question about lorazepam storage, and it started out with a online discussion, and then we eventually did a walkthrough together with key stakeholders, so with the unit, and then Tom, Mia from licensure and accreditation, and then myself, to just get all the key stakeholders together and brainstorm and come to a resolution. So with that said, I'll pass on to Tom for
Yes.
more.
Yeah, thank you. Yes, and that was a great example. That was something that started as an item that we identified. Um, in the healthcare setting, rooms must be the appropriate air pressure relation to the exterior areas for clean and soiled storage purposes. And there was a room that was not properly, the door was always open. And some of that conversation led to why the door was open. And we were able to have some conversation within the tool, back and forth with the unit, with our pharmacy teams. Why the unit felt the door needed to be open was because medication security. Well, we were able to collaborate and then meet in person. And the walkthrough in person, only took a matter of 10, 15 minutes because we had some background built prior to meeting in person using that discussion tool. And everyone could see the picture. They knew which room, yeah, add some comments, and it worked out great. So I agree. There's some, the electronic solution, the ability to kind of collaborate offline and build some core information saves you time in the field. So when you meet in person, you've got 3, 4 groups, everyone's on the same page and knows where that, resolution's headed. So I think that was one of the things we try to utilize when we can. In addition to the discussion tool, um, we also have the ability to add checklists. And our checklist for environment of care is different from medication security, and they're driven off of regulatory requirements and Joint Commission. But you can add checklists as simple as recycle waste audits, pharmaceutical waste audits. And so I think an added tool is we use the core database, the core contacts and responsible people built within the tool, and we can go do any type of inspection that we can upload into the system and still have the analytics feature, still have the communication features, and still use our core responsible people and our built-in contacts. So we use it for things such as pharmaceutical waste compliance rounds. We've used it before in the past for a specific accreditation survey prep. Our food services team uses it for their food safety inspections. And like I mentioned, I anticipate using it soon for our something as simple as recycle waste audits. And then there's potential for even our infection prevention team to use it with a number of their audits they complete here on a regular basis.
Yeah, and I'll add to what Tom's saying too, that I know that a lot of the UC medical centers across California have already had a lot of success with integrating into their work order system within the Inspect application. And we are also moving in that direction. So our maintenance department right now currently has an RFP for a new work order system that we hope to be able to integrate into Inspect as well.
Wonderful. Well, thanks, you guys. Thank you for telling us about the benefits. I'm wondering, have you had any challenges,
Yes, so
Sam?
thank you. I'll share, one of the challenges that we've had is we have a team of surveyors. So there are times when we have multiple surveyors inspecting a site. And we want to ensure that the reports are merging properly. And most of the time, it works really well. There has been a couple of instances where there were glitches. So we work very closely again with the RSS team, specifically our customer success specialist, to really explain how we utilize the tool so that they can better understand our issue, and then trying to resolve that together. So that the relationship that we have with our customer success team specialist, that is really important. We also, have been working on utilizing the analytics tools as well too. So while it's very helpful with the dashboard, we're also working to see if there is a way to really customize these tools so that they can meet our need, so that there's less of the manual editing to pull out the meaningful data that we want to share to certain group of key stakeholders. So those are the couple things that we've been working on. And I'll pass on to Tom to share a little bit more.
Yeah, most definitely. Yeah, and I think some of the issues sometimes run in between when you're in the field rounding and you're bouncing from Wi-Fi to cellular. Sometimes there's pauses within that, but I think that's more of our areas here on site, that maybe the Wi-Fi and the cellular reception isn't always great. So anything with technology, you always have some of those struggles. But I think overall, the capabilities and the convenience outweighs some of those items. The other thing we struggle with at times is, as we talked about our inspections, and we have responsible people. So every department we have built into the database has a responsible person. That's usually a department manager. It's someone that's accountable for that department. Well, here within the medical center and our health system, there's movement. And so when we have departments that change leadership and there's department moves, that's one thing that we have to maintain on the back end. So it's more of a systemic issue for us, just with the movement and keeping that responsible person list up to date. It takes a little bit of work on the back end. Um, I have the luxury of Sands team who rounds monthly, and they're in areas, once a month, where our team goes. We go weekly rounds, but we only see each department once a year. So Sands team reports back to myself when there's some movement. Staffs have changed, so I go in the system, and it's really easy. It uploads all your staff. We go in there, make a change. We take someone off, we add someone on. But that is kind of a manual back end, because the database does not integrate with like our HR database at this time. So that's just one of the systems you have to work around. Again, and although it's a challenge at times, we've built a successful workaround and been able to keep up with the responsible people to make sure the right people get the information in a timely manner.
Great, thank you. I'm wondering if there's an example of a success story where the results from the survey have led to like a significant improvement in patient safety or compliance.
Yeah, we
Success.
definitely have lots of examples. And one that I'd like to share that, just occurred more recently is during our survey, we found some medications that are stored in biohazard bag. And like I mentioned, pictures are worth 1,000 words. When we talk about biohazard bags, people may say, well, I don't know what you're talking about, but we have pictures. So basically, these medications that are considered clean, and staff was just essentially looking for a bag to put them into, to keep the patient specific med bin clean. And so they just happened to grab a clean biohazard bag, but that shouldn't be used. So we shared this with our nursing pharmacy med safety committee meeting, to work on, to collaborate and work on a solution for this, where we developed a flyer to educate staff to utilize clear plastic bags. We share with them how to order the clear plastic bags, ensure that they are strategically placing the clear plastic bags in spaces where the nurse find it easier to just grab and use, for example, on top of Pyxis, for example, so that we can promote using clear plastic bags as opposed to these biohazard bags. So that is still in the work, but we are working with nursing, and we find that these collaborations are really, really helpful, because we're identifying who's actually using the bags, and how can we improve. So that's one of our success story that is ongoing at the moment as we continue to work on this.
Yeah, and I can add, just in general, a success story is just our overall environment of care rounds. They've continued to support an improvement in general regulatory compliance, including improved surveys with our most recent Joint Commission accreditation survey, completed last year with no condition level findings. So from a full implementation of RSS Inspect program and analytics tracking back in fiscal year 2018, we conducted 89 inspections. We had 712 findings and had a 64% resolution rate. Well, as we continue to implement the program and create, efficiencies, we've actually last fiscal year almost doubled the number of inspections. We ended up with over 3,750 findings, but we're at an 84% resolution rate. So the use of electronic and convenient rounding and communication tool has led to a significant improvement in the overall resolution of our findings, which results in improved life safety environment and overall minimization of risk. And so just having that ease and convenience the numbers don't lie. There's a 20% increase in the number of resolved findings, and those are actually at a 60-day, closure rate, which before it was just 64% in total. So I think that kind of is a great success story for us.
Definitely. Definitely. Thanks for sharing that, both of you. Erica, has the software assisted at all with Joint Commission accreditation at all?
Yeah, absolutely. So we have, been running this program for a few years now, and we've gone through 2 Joint Commission surveys. So for our 2019 Joint Commission survey, we actually had each of the subject matter experts for environment of care come together and present to the Joint Commission surveyors in one large meeting. And during that presentation, we actually did a smaller presentation that showed how we were utilizing the Inspect tool and how we were using it for our weekly environment of care rounds and how we were closing out findings. So the surveyors were more than impressed. They were very excited to see our tool. They really didn't have very many follow-up questions because they were so impressed at how well our program was being run. So then flash forward to our survey from last year for 2022. Our surveyors were again continue to be impressed with our program, and as Tom mentioned before, we actually had the most successful Joint Commission survey as an institution overall that we've ever experienced, with no conditional level findings, which is quite rare for an institution our size. So we're really proud of the progress that we've made with our program, and we really do feel that it has improved our overall compliance and our Joint Commission accreditation.
Thanks, Erica. I really like the proactive approach to educating the surveyors prior to starting the survey so that things go smoother. That was a great idea. I know you put together a quarterly report that you share with leadership can you speak to that a little bit?
Yeah, absolutely. So I kind of had alluded to earlier that we, not on top of the Inspect tool, we also use analytics. So analytics dashboard is a great tool that we use to pull data to create this one-pager presentation that you see in front of you. So this is a quarterly report that we create using all of the data from analytics. And this is presented to our campus-wide safety committee, which is, as you can see, the one pager is filled with lots of data, lots of information. We have everything in here from our top findings for the quarter to number of inspections, number of findings, and most importantly, our closure rates by routing group and closure rates for our overall findings. So we, use this data to escalate up to our leadership. And we also utilize this data to leverage our safety committee goals. So for the last few years, we've had safety committee goals around our closure rates. We've been trying to focus on closure within 60 days to mimic a real Joint Commission survey. And we've seen an improvement over the last few fiscal years with being able to close out these findings within 60 days.
Awesome. Actually, Margaret Online just gave you guys a kudos. 84% resolution rate is amazing. Congrats and great job for patient and staff safety. So thank you, Margaret. Great. Sam, we have a view of your analytics dashboard, which is very impressive. You guys have been very busy doing inspections. Can you just speak to how you utilize this data?
Yeah, so you can see that we have a lot of data and, just from the sheer number, but also what you can see here too is that we have a pretty high percentage of compliance. And I think that is in part due to, our continuous survey, our continuous staff engagement to be able to get above this 90, percent compliant rate. And with that said, I can give an example of how we share the data because of all the abundance of that data that we have available. I had a provider at a clinic. She was working on a process improvement project involving labeling of multiple dose vials. This clinic has had some challenges with labeling the vials, so she reached out to me just asking, by chance, do you have the data? And I said, absolutely, I have the data, because that's one of our checklist question, whether they have properly labeled beyond use date on their injectable vials. So I shared that data, and she requested for monthly data from our inspection for the last year, and that was helpful to her because she wanted to know, how, what impact it's made on, the rolling out the staff education, and then looking at, what other root causes. And at this point now, I'm collaborating with her. She is creating a label that the clinic staff can use, where it's pre-filled instead of having the provider writing in expiration dates, which we find it so challenging. She's actually implementing this new labeling where the label already is pre-filled for the day, and that the provider is asked to label any vial that they open. So we'll see how that goes, and I'm hoping to be able to share more data with her after this implementation, and maybe see how successful this program is. So that's one example that I really wanted to share.
Thank you, Sam. That's great collaboration. I'll be interested to hear how that goes, and more that you learn from that. I think right now, I think we're going to open it up to Q&A. We have a couple of questions that have come over the chat here. The first one is directed at you, Sam. Are EHS staff the only staff that use the RSS solution, the electronic checklist, or do hospital staff conduct rounding too?
So I can speak for medication security team. Our team utilize the checklist, but we also have different groups like EH&S, Tom and Erica's team utilizing the checklist as well. They have a different checklist. We have a checklist that's specific to pharmacy. During the pandemic, we actually thought about sharing our checklist to individual clinics so that they can do self inspections. But we've also learned that it's quite complex, because we actually have a lot of questions, as you can see from the previous slide, that it was it didn't work as well, for the individual area to be able to complete the survey. So what we ended up doing was we had our pharmacists who are embedded within the ambulatory clinics actually assisted with some of those surveys. So that covered, the time, where we, with the pandemic, where, we were unable to survey those areas. But since then, we're back to, surveying again, of course. So maybe Tom and Erica can also, chime in on, how other areas utilizes different checklists, but still utilizing RSS Inspect.
Yeah, and I can add some checklists. And I think initially this effort has grown from the EH&S, right? So ultimately, UC-wide, it started with our environmental health and safety directors and leaders. There has been some growth outward. We don't see a lot of frontline nursing staff using the tool yet, but I think that's where we're headed, right? Our goal is to expand this in. So currently today, we do have a lot of School of Medicine labs that use it. They use it for some of their lab inspections, some of their biosafety inspections. Our food nutrition services team uses it. There's some checklists that were created for anesthesia teams and our CPU for an instrument audits. We do it for something as simple as oxygen cylinders. And then also our safe patient handling team and workplace violence team have used it in areas where they're doing inspections as well. So again, it's kind of grown from environmental health and safety and users that do rounds kind of focused in those subject areas. But I think ultimately the growth would be getting to our nursing frontline and doing some of their inspections as well.
Yeah, we definitely have some requests for, CAUTI and CLABC for pressure sores, for hand hygiene as well. So folks are using it for that. Another question came in from Margaret. Does the UC Davis EH&S team have any challenges with getting new staff on board with the electronic safety survey? And how do you go about getting new staff to use the surveys? So I think we're talking about like leadership buy-in and how have you had pushback from folks?
No, I think it's embedded enough into our system now that we're able to. And I'll kind of read over Margaret's question too. I think she's maybe even asking about just the growth we've had here at our facility. Are we anticipating an expansion of our team members? Hopefully, hopefully we'll see that as we grow. There's always that need, and as you expand, then you always touch multiple people and more teams that have to use the tools. But I think with us, the electronic inspection tool has been something that's embedded within our day-to-day activities, and it's been a transition to new members. And as we expand team members, it's used in so many different areas. Everyone's comfortable and confident using the tool.
Yeah.
And I can add to the, sorry, go ahead.
No, I was just going to add to Tom's where, when we do have people who need additional training, there are a lot of resources that are, that we're able to utilize. Our customer service representative is able to provide us, documents that can help with our training. And a lot of it is just hands-on training and utilizing the tool. And so most team members don't have a problem with starting to utilize the tool. And we have a lot of great resources within risk and safety solutions that we have available to us with our training as well.
I was going to add to Erica and Tom's comments. Along the same line, I think, we have utilized our customer success specialists quite a bit to provide the training material. Just as I mentioned, when we involved the clinic pharmacists during the pandemic, we rolled out training for them, just like we did with our team. We recorded the training at that time as well too, so that they can watch it again, at their own time. And then get some practice with the tool. We have grown a little bit. Initially, a couple years ago, we were a team of one full-time pharmacist, that's myself, with a per diem pharmacist who worked 1 day a week, and then 2 pharmacy technicians. And now we have 3 pharmacy technicians and 2 full-time pharmacists. So we onboarded the additional staff the same way. We just had a recent staff retirement, so now we're onboarding another pharmacy technician, and we're utilizing just the same tool. Like Erica mentioned, the hands-on experience really is, most helpful. We utilize the quick guide provided, from RSS, give the staff an idea of how this application work, and then once they start using it, it's really user friendly. And we haven't had any issues with training of anyone on our team, even staff who feels like they're not IT savvy. They pick up the application just fine.
Awesome. Okay, great. I see another question from Carol in Regulatory Affairs. She says, great information. They share some of the same benefits and challenges. She's wondering if you conduct surveys for clinical care. And for example, observing how restraints are being managed and documented for fall risk processes, or evaluation of the patient at admission or adherence to bundles. Likewise, patient safety and labeling of meds and lab samples, patient-specific TJC type tracers. So it was a multi-part question.
Yeah.
So
I can take on the part of, sorry, go ahead, Maura.
Oh, no, go ahead.
I can take on the part of, labeling medication. So we, when we survey, we do observe staff, if they're in the medication room, if they're in front of Pyxis and they're pulling medication, we want to see, are they, labeling multi-dose vials if they're in the medication preparation area. Are they labeling syringes if they're drawing up syringes? So we do directly observe those. I can't speak for the other part of the question, but that's embedded within our inspection tool in terms of a question, and we can address compliance.
Yeah, and I think we briefly hit on the kind of root of that question earlier. Was right now we don't use it for a lot of clinical care specific rounds, but I think that's where we're looking to go, is expanding that into those clinical care areas, because those are areas that this tool and any electronic tool would allow for the analytics data as well. So We aren't currently today. And if there are, some of these inspections may happen behind the scenes and we don't see them all. But I know it's not widespread, but I think that's ultimately where we'd want to grow to and get there.
I do know that some of the other institutions that use our product are using it for safe patient handling processes, as well as workplace violence and that sort of thing. Not
Yeah.
as many nursing groups, but there's opportunities there, as the tool does allow for the identification of findings and the follow-up, the actionable items that are automated. Let's see here. Another question we have is, I think this one's directed towards you, Sam. Have USP 800 regulations or any other regulations related to pharmacy changed how you perform your medication security surveys?
No, it actually has not. Our tool is built in a way that it's really comprehensive. So, with the changes, it's already embedded within the questions that we have. So we're not having to make additional, changes. But if we do have a need to make changes, the tool is really easy to use to add a question, remove a question, or edit a question that's on our checklist. That's very easy to do.
Great. And lastly, what improvements in the tool would you like to see?
I think at the moment, we are really satisfied with utilizing the tool. I think what we are now looking at, I mentioned earlier, the analytic tool. We just have a significant amount of data, and we really want to continue to share that with all the key stakeholders. So really trying to carve out information that is useful for a certain group. So, for example, anesthesiology department. How do we carve out their findings and share with them? Ambulatory clinics, how do we efficiently carve out that information and show them on a dashboard, kind of like what you saw with Erica sharing the dashboard that she shares with leadership. That's the direction that we want to go. It's really for transparency. It's really to continue to engage our staff moving forward with our effort to be survey ready.
Yeah, I
Yeah,
agree.
agreed.
Yeah, I think I'll go in further. It's kind of creating those little internal subgroups, right? It's great about creating groups. So how do you create subgroups? And sometimes that's difficult to create subgroups of leadership that may oversee 8 clinics. So how do you take the 8 clinics and group them into a group that you can pull data for? And the other thing for us is, I think for me, it's one thing. How do we continue to improve what that end user sees? How does that responsible party continue to see their data in an efficient manner that they can go through and scroll to the report and find where they are, what's still pending for them. So I know there's been growth and there's dashboards that they see. So there's always been some continued expansion on that. But I think as it can continue to improve on what they see. And then we also work with escalation. So anything we put in the report, there's timeframes preset that give out emails to certain groups. And those emails go out to the nurse leaders that are on the reports. And so one thing we would like to see, and one thing we're working on, is how do you improve an escalation process that goes to executive directors and continues to escalate to leaders above the folks that are identified on the reports? Because sometimes we just need better traction, and we need that clear line of sight when it's a systemic issue, not just an issue on one unit.
Yeah, and I know that we've seen the test pilots for the version 2 for Inspect, so we're really excited for the launch of version 2, and I think there's some really great improvements that you guys have really taken what we've asked for to heart, and I think there's going to be a lot of that improvement that we'll see in version 2.
Mhm.
Thank you all. We definitely, I'm hearing what your feedback is, and for sure we're implementing those changes in V2 and additional features to help you folks collaborate and do your job. So Edgar is asking where to get resources for the RSS Inspect application. Well, we are going to be, as you all know, we offer technology here. And if you think that you would benefit from a 15-minute conversation with us, we're going to send out the recording and a survey and a link to be able to get in touch with us and just have a 15-minute chat. We're here to help you. And we love to get your feedback. If you'd like a part 2 of this, we're happy to organize that. I just want to thank all of our panelists. Great job. And also thank you to the attendees for your questions. And everybody have a great day. And we hope to do another webinar with y'all soon. So thank you.
Thank you.
Great.
Thank you all.
Bye.
Bye.